Hi, everyone. I'm Dr. Anita Wong. I'm a board certified emergency physician and fellow in anti aging metabolic functional medicine. And I practice preventative medicine, preventative aesthetics, and I focus on a resilient immune system, restoring energy, better intimacy, a stronger core, anti leaking, anti sagging. So, Happy New Year is January 2022. And what is new this year? I would love to introduce to you um, this year that I have Liz. She's my assistant, and she is working in the office. And you can schedule with her a craniosacral therapy. I always tell people, not to say always, no, is that you should try to get into that rest and digest phase. Try to get balanced because we are frequently in the um, um, sympathetic drive, and we want to get into the parasympathetic drive, and we need to stimulate the vagus nerve. And one of the techniques I enjoy is craniosacral. And Liz actually helped me recover from when I was rock climbing and fell and injured my back and my legs. And she was able to massage and do some myofascial release and help me get back on the road. And now she helps me to stay balanced with some craniosacral massage. So I encourage you to check it out and give yourself a treat this year. Um, and not to stress out and not to worry because we are still in this pandemic. And I hear people worrying about, what are we doing with Omicron? What is going on? And people thinking lockdown and close the borders. But COVID is a coronavirus. We have 4 other coronaviruses. They're going to be around, unfortunately. Um, but what do we know about it? We know that viruses mutate, and we know that when they're a mutation, they're trying to live and prosper. Right? They don't want to kill the host. So it's always the host versus the pathogen. And so they don't want to kill us off, but they need to survive and they need to spread. So the COVID has become more fit, as I call it, um, because they're more fit to uh, transfer and spread. And what has happened is that it's gotten to be the incubation period is shorter. The onset of symptoms is coming on sooner. Used to be 5, 7, 14 days we had to watch. Now we know within 5 days that you'll get symptoms. So it's a shorter onset. You're still gonna get your headaches, fatigue, fevers, sore throat, things like this. But 80% of it is an outpatient disease. People are going to recover. It's the 20% that become very ill. And because we didn't know what it was about, where was it hitting hard and inundating our healthcare system, is those people who had other illnesses, whose body was not functioning optimally, who was not taking care of it optimally, not eating as well. Um, so only the 20%. Other interesting thing is only 10% of the population that are spreading it. So you wonder, why is it in a household not everybody got it? But not everybody there is a super spreader or spreading it, right? Because they're able to handle it and manage it and take care of it. The things that we don't know about it is after you have COVID, these symptoms that persist 4, 6, 7, 8 weeks to a year, longer, we call long COVID at this point. What is causing that? What is producing that? We have other viruses that also this occurs in. We need to learn more and how to prevent that. So we don't want to have the super spreaders, and we want to we don't want the people who don't have optimal health to fall ill. So at the beginning, the elderly, the people who have the comorbidities, and now we're seeing it shift over to the younger population, a little more healthier. So we're not seeing quite as much, but still there is those who are being hospitalized. And that still can happen. And what I find, well, one thing is that testing actually really helps. And I'm glad to hear that we're trying to get testing out. I had said this way in the beginning that testing is a thing and that we had the capacity to do these dollar tests that you just, in the morning, you test. And then you go, oh, I'm safe to go to work. Oh, I'm safe to go to a restaurant. Oh, I'm safe to go see grandma, right? So frequent testing, that it needs to be affordable, right? And people need to understand we need to know when you're infectious. We don't need to know if you have COVID. Most likely, everybody's been exposed, everybody has it. So the PCRs are very sensitive and will detect whether or not you've ever had COVID. And you have the IgG or the IgM, or there's going to go down to what is really important is the cycle threshold. So when you do these wash and how you do the testing to see if there's any viral particles left in your system. And you do these cycles. So when they do these cycles over and over and over and over, and they get down to 40 cycles, and they say, oh my gosh, you had COVID, but you're not infectious. It's maybe going through cycles of 20, maybe 30 that you're infectious. So those particles are right here in the little nares. So when you do those antigen tests and you do that and you're positive, you're infectious. Stay home. When you do the antigen, you may still have COVID, but you're not infectious. Wear a mask. Okay, masks do help, right? So and the other thing is that I believe we're going to find that this is more of a nutritional disease. Right? So we have found that if you're low in vitamin D, selenium, zinc, they have worse outcomes. They end up in the ICU. Vitamin A is important because it really helps with the mucosal linings, which is going to be the lungs, the sinuses. So you're going to have the sinus congestions, cold. You're going to have the bronchus, the bronchial coughing, things like that, the shortness of breath, people who have asthma. So nutritionally, being sound and being fit. So generally, if you're obese, you have diabetes, you have hypertension, you have other diseases, you're already not working optimally. And depending on how you're eating, you may not be nutritionally as fit. You want to be as fit as the virus, right? So lifestyles really matter. I always tell people, I look at genetics and I look at what is under the hood, what's going on in your body. Well, it's 25%. So people say, oh, I'm destined to have cancer or diabetes, whatever, because my parents had it, my family had it. Yeah. No, only 25% of your genes and what your lifestyle can flip it on or off. You flip on the cancer gene, flip on the diabetes gene, you can flip it on, you can flip it off, you can turn it off and on. So lifestyle really matters. So eating at fast foods, not sleeping, running ragged, not exercising, all of these things amount to lifestyle. And that's what is harmful when you get COVID. So improve your lifestyle, all right? That is one of the ways that you can really protect yourself is, improving your lifestyle, improving your nutritional, wearing a mask. I wear a mask when I feel that that's a high exposure, high risk. I worked in an ER for 39 years. I would wear a mask and everyone thought I was crazy, but I didn't know. And especially during flu and cold season, I would wear one at all times because if I was looking at somebody's ankle and they didn't tell me that they had the sniffles, I just didn't want to be exposed. Because why? I do believe in the host being strong and we can fight off because it's the host versus the virus. But I'm not perfect. There are days that I like to stay up late. I like to have a bit of more sugar. I like to just lounge around and don't get my exercise. Sometimes I want to have some French fries and not eat my whole fresh veggies and things. And so that could be the perfect storm of when I go and interface and I'm going to catch something and I can't ward it off. So I need to know. So when I'm doing those things, I take, oh, I don't wish I had it with me here. I didn't bring it. I just ran out of my last one. So immune GI Restore, which has antimicrobials, antibacterial, antiviral, anti-parasitic, antifungal. Um, it has anti-inflammatory. It just helps the gut stay healthy, where 70-80% of your immune system is active there. So I want to keep the microbiome healthy. I want to keep things in balance. So if I'm eating more sugar, I'm going to want to take this so that because I have the good bacteria, I got the bad guys. I'm eating more sugar. Guess what I'm growing? I'm growing more bad guys. So I want to give something to fight those down. That's my immune GI restore. So I take there's 3 pills. They come in packet form. So I take it anywhere from 1 packet to 3 packets a day, depending on to what my exposure and what my lifestyle is. And then sometimes I don't take them. The other thing that I do take, which I'm going to grab here, is if you can see this, is the uh, adrenochrome. And what I use this for is because it's a lot of adaptogens. It has ashwagandha, it has rhodiola, it has holy basil, and all of that is just to really help your cortisols just stay even keel. So I was just telling someone I hadn't been taking mine regularly, and been under a little stress, and I could just feel that anxiety creeping up in me. But usually when I'm like working in the ER and I have some, I have gunshot wound here. I got somebody cardiac arrest over here. I got a baby that can't breathe or choking or all of these one by going running around can manage my stress. I'm kind of used to that. Um, so I need though to not have the anxiety too much. And so I find that a good little extra thing. Um, so those are my tips. Protection: wear a mask when I feel it's appropriate. Um, use my immuno GI and adrenochrome. The other thing I want you to just share with you about masks, because I know people really don't like it, but I actually love it. It's my own little environment in there. I can rebreathe my air, some humidity. You don't want to rebreathe too much of the CO2, especially if you're hyperventilating. Hyperventilating, you want to rebreathe the CO2 because you're blowing off too much. But yeah, but it's called hormesis, and stressing your mitochondria just a tad, just a slight, really builds your immune system. And so I like to wear it because I know I'm doing a little bit of hormesis and not the stress of where I'm having anxiety, but stress where I'm actually boosting my mitochondria a little bit. So I don't think it's a bad thing. I don't think you're suffocating, but I think it's something you have to get adjusted to because you certainly wouldn't want your surgeons to say in the OR, I can't suffer the heat and I can't wear this mask anymore and it's just way too hot and I can't breathe after this, and doing this 18-hour surgery and say, I'm just going to take it off now because I need it. I think it's just an adjustment period going through it. And some people will adjust, some people won't adjust, and you don't have to adjust. And no one's making you, it's just a tool that you can utilize that I find helpful. Well, at least was very helpful to me. One other thing is, people ask me, what is it that I do here? So it's a little boutique-y. I don't like to have a lot of people here, so this is perfect for pandemic um, because in this, I'm a little distracted because I see that my computer's running out of battery, and I hope I have enough to get through this. But um, I, so I don't have that many people in the office. It's usually myself and you in this 5-room suite here. Or maybe it's larger than that. And we're going to have Liz and maybe her patient. But so it's pretty safe. I have HIPAA filters in here. Usually I try to schedule one in and one out. There's a parking space, so if you're someone's in it and they haven't left yet, you can just kind of park there, and the empty space is there, or block in that space or my space, and then come in, let us know, and then you can exchange spaces. Or if you really want to get healthy, it's free parking 2 blocks up and get a good brisk walk in, right? So many people will ask me, well, what is your program in this boutique wellness and this holistic MD type of thing? Um, well, it is, there is no my program. My program is what your body needs and what I find under the hood. Um, and I love to give that analogy of people who work on their cars meticulously, making sure the levels are just right, the oil concentration is right, the filters are clean, everything is just running and humming right. Well, you need to check under your hood because you don't know. Do you methylate well? Do you detoxify well? What's going on? I just did this test on myself because about one thing I know that I don't detoxify well. I have in the major pathways. I have the first path and the second path. I don't detoxify. So I have to do a lot of work on that. But one thing I had noticed when I would test my micronutrients to see how well am I doing on my diet, what's going on, I always see that I needed more vitamin A. Doesn't mean that I'm deficient, but my cells demand it more. I'm not a big carrot lover. It's not that I don't like it. It's just that it doesn't give me a lot of joy. I don't know why, but I like the crunch if it's raw, but I'm not a big fan of it. And I have this new test, and it's genetic testing, and I tested it, and I have the genetic markers that shows that I do not convert beta carotene into the active form of vitamin A. So carrots are beta carotene. I don't convert them. So I would need to eat a boatload more in order to get the amount that I need, or I just need to take my vitamin A. So I've started doing that because now I know that I really wasn't doing that because I didn't really see the need to supplement vitamin A as much as, especially during COVID. Now I do with the lining of the lung, make sure that you get enough because very rarely is anybody deficient in it. Um, so that is one how I use some genetic testing, and which 30 to 40% of the population has a mutation in methylation, so they don't detoxify well. Um, and so, I use that. And, it's the new year. Go for a new you. You want a new look? Look under the hood. Let's figure out what it is. Take some data, information that may make you want to have a lifestyle change. And I'll coach you through it and help you with it. So I take a lot of history, figure out what's going on. What are your symptoms? What is bothering you? We'll look through whether or not we think it needs to be what tests to do: blood, urine, stool, saliva, um, hair. We can do it all different types. Look at your budget, what's in your budget. I want to look at your previous labs from your primary care doctor because I like to work with primary care doctors because the primary care doctor you want to have is my you subspecialists, and the subspecialists, they have oncology, they have subspecialists in cardiology, and then you have subspecialists as wellness as myself. So when so I work with wellness, and oh, that's my front door, so I know someone's coming in, and the the um, um, So, and then we'll do some specialty testing, and then we'll plan on a budget and make a treatment plan for your specific goals. Um, I don't know if you can hear that music, but hopefully that is how I know that you're coming in and going, and that I won't miss you, because I have had sometimes I've missed people because I'm grossly intense with someone but anyway, so hopefully you'll understand the program is set by what your body tells me and what is going on with you, and I would love to coach you through that. with some scientific data and looking at your genetics, looking at your lifestyle, and you decide on the lifestyle changes, making new neural pathways. There's neuroplasticity, getting you into balance between the sympathetic and the parasympathetics. So many things. I hope you've enjoyed this. And as always, if you find this information, that's an always, information helpful and like it, share it. Please let me know what you are interested in and hearing about. And you can always reach me via my website, um, anitawangmd.com or 949-734-0580, and you can schedule a complimentary discovery call with me. We could chat 15 minutes and see if you have more questions or want to schedule some demos with some of the devices that I have here. But anyway, till next time, be safe and be well.